prevalence of breast cancer higher in the younger age group in Goa?
Goa. See, one thing, definite reason for that is because of the family testing is not done here. See, what happens is, like, one thing what I've observed is a lot of young female patients, they have a strong family history. Their mother had a breast cancer, their grandmother had a breast cancer, which says that there is a genetic damage.
Acha.
So none of these patients are getting it checked. So when a genetic testing is not done, it is like a virus. It keeps spreading from one family to the future family. So I think that is one major reason. Other reason for breast cancers among young females is because of late marriages. Sometimes when you get married above 30 years, so the hormonal levels are very high, the estrogen hormone. That itself is a risk factor. And sometimes when you get married and you're not having children for a long time, some people are married and they're not willing to have children. That is again a risk factor. And sometimes a lot of females, they don't breastfeed their babies. They breastfeed for maybe 1 month, 2 months, and they stop breastfeeding the babies. So breastfeeding is a very protective thing. When you don't breastfeed your babies, the risk for breast cancers are very high among young female patients. So these are some of the factors,
which attributes to breast cancer.